couple 100,000 people in our area are still without electricity, and the issue has posed serious health risks and led to 3 deaths related to the heat. The Houston Health Department reports triple the amount of people visiting the hospitals because of it, and a huge spike in carbon monoxide poisoning. Dr. David Persse, Chief Medical Officer with the City of Houston, joining us now to talk about ways to avoid a trip to the hospital for those types of emergencies. Good morning, Dr. Persse.
Good morning, Haley.
So what are your top recommendations for people who might still be out without power?
Well, I think we need to be planning ahead. If you're going to be using something to generate power for you, like some type of a generator, and let's also think about people who are using like grills and things and stoves, maybe do some cooking because they don't have regular electricity. So all of these things they'll produce, especially if your generator is gasoline powered or diesel powered, they're all going to produce carbon monoxide. Now, carbon monoxide is an odorless, tasteless gas. Very often, you might smell like the combustion from gasoline and stuff and think you smell it, but the carbon monoxide itself is odorless, it's tasteless, it will accumulate in your home and you won't even know it. So never, ever run a generator or do any cooking inside your house. One of the common mistakes we see are people putting the generator in the garage with the garage door up. That is absolutely not good enough. The generator needs to be at a minimum 20 feet away from any door, window, or event where that carbon monoxide can get into your house. And you talked about all the cases, and these are people who thought they were doing it right, and unfortunately found out that they were doing it wrong. The other thing is you got to have a battery-powered carbon monoxide detector. Really, really important. They're not that expensive. And if it starts beeping, you need to get out.
I'm so glad you mentioned that, because that's exactly what I was going to say, that people think they're doing it right. They have, the emissions going from the generator in the opposite direction of their house, or they've got it outside and they think that's good enough. But what I'm hearing from the fire department too is that people are putting it in breezeways, or they're putting it just too close to their garage door. And really, I mean, that's enough carbon monoxide to kill your whole family. So this is really dangerous, and no wonder that you've seen such a huge spike at the hospitals because of these symptoms. But tell people who, might think they're doing it right, so they might not be paying attention, what are the symptoms that you would feel if carbon monoxide is getting into your home?
Yeah, and there's another complicating factor. So the symptoms are not anything in particular, right? It's you're going to feel weak. Of course you're weak. You're doing a lot of work, right? You're going to feel crummy. You may get a little bit of a headache. You may get a little dizzy. All of these symptoms are things that people can sort of attribute to all the work that they're doing, when actually it's the carbon monoxide. And so you got to pay attention to this. Again, it's a headache is very common. Feeling weak, maybe nausea. Overall, just feeling really sort of crummy, which if you're doing a lot of work, you're going to feel crummy, right? But it may be the carbon monoxide, so you got to pay close attention. Here's the other thing is that if you've got multiple people in the house and you all start feeling crummy at the same time, that is a big red flag that you might be dealing with carbon monoxide poisoning.
Yeah, and you said, I got from the City of Houston that there's been something like 116 hospital visits because of this?
Oh, yeah, the number has just shot up. We've never seen numbers this high before. The fire department has never responded to so many carbon monoxide calls like this before. We've never had this much of a power outage for this long before either, but nevertheless, the carbon monoxide calls are just through the roof compared to what we've had in the past.
Yeah, or in the past when we did have power outages this long, it just wasn't this hot. This extreme heat is what's making it so dangerous. So what, if anybody's listening now that still doesn't have power, what are things that they need to avoid doing to avoid a heat-related illness?
Okay, so now the heat-related illness is a slightly different thing, but and also important, and we've also seen much bigger numbers with heat-related illnesses than we generally see. So a couple of things. One is you want to make sure you're hydrated, and here's the thing that people don't often understand. They think that if I get thirsty, I'll drink some water. In 15 minutes, I'm gonna, my thirst will be gone and I'm good to go. But what you don't understand is when you drink that water, it goes into your stomach, right? And yeah, within about an hour, it will get into your blood system. But it takes many hours for it to get into your into your cells. So if you just standing there next to a couple glasses of water, remember your body is 70% water. Okay, and so these 2 little glasses of water, well, they may be big glasses of water, but compared to your whole body, they're little glasses of water. And so when you got to get that water into your cells, that doesn't happen quickly. So you need to pre-hydrate the night before. You need to stay ahead of your hydration as you're working. You need to work in the early hours or late in the day when it's less hot. When you're outside, wear lightweight light-colored, loose-fitting clothes to reflect that heat, not absorb the heat. When you got to take a break, try to get into air-conditioned facility if you can. Now, a lot of people who are doing this, they don't have air conditioning because they don't have power. And that's a real challenge. But if you can, you need to get into air conditioning. And if you can't get into air conditioning, understand it will take you longer to recover inside your hot home with a couple of glasses of water than it would otherwise. So one of the other things you can do is you can try and take a cool shower or take a cool bath. That will help dissipate the heat too. But the big thing I want people to understand is when it comes time and you need to take a break, you need to take a much longer break than you think you do. You need to feel really as close back to 100% before you go back at it again, or you're just asking to get in trouble.
Yeah, and nobody wants a hospital visit, but especially right now, Dr. Persse, I'm hearing from people who are working in the emergency rooms that they're pretty packed right now. There's long wait times. Can you confirm that?
Oh, absolutely. We've had so many people in the emergency departments. We're hearing 300, 400% of normal emergency department volumes. One of the complicating factors is at the hospital, for people who will be discharged to go home, their homes don't have power, and so they weren't able to be discharged. This is one of the reasons we set up the medical surge facility at NRG Stadium, actually the NRG Arena, so the hospitals could offload, because otherwise people who need to be admitted, they're backing up into the emergency department, making people back up in the waiting room. It's even gotten to the point where we've had ambulances that were there for so long. We actually got ambulances from across the state to come into Houston to go into the hospitals. They watch 4 or 5 of our Houston Fire Department ambulance patients so that we get those ambulances back out on the street. And in fact, it's not just been HFD ambulances, but this has been a regional effort with hospitals across the region so that EMS ambulances, our local EMS ambulances, can get back out on the street. Otherwise, they'd be in hospitals monitoring their patients, waiting to find a bed.
Well, we need to do whatever we can to alleviate that situation. I heard somebody mention that it was kind of like COVID and Katrina all happening at once at the hospitals. So thank you for that insight and for the tips on staying safe, because I know carbon monoxide and the heat both are big concerns of yours right now.
Absolutely. Thank you, Haley.
All right. Thank you, Dr. Persse.